Okay, hello, my name is Chris, and today I'm going to talk to you about colorectal cancer and what you should do to help prevent it from escalating. A few years ago, my girlfriend's dad was experiencing symptoms of colon cancer and decided not to speak up about it until the symptoms were too unbearable. He was experiencing extreme constipation as well as rectal bleeding and blood in the stool. He was also experiencing abdominal discomfort, cramps, gas, pain, and the sensation of his bowels not being completely empty. My girlfriend is a nurse, and she understood the situation immediately and pleaded and begged him to get a colonoscopy. He refused to go get checked up because he was afraid of the results that would come back being positive for colon cancer. He eventually got checked up because my girlfriend would not stop crying because of how serious the situation was. As it turned out, his doctor told him that he had stage 3 colon cancer and he needed to have it surgically removed as soon as possible because each passing day means that there will be less and less chance for a successful surgery. During the next couple months, it was extremely difficult. Everybody was sad. Everybody didn't know what was going to happen or what was going on. And it was also a time where it was pretty difficult to get an appointment for surgery. But despite having a 40% chance of survival, he was still very positive that he was going to come out on top. But everyone was just worried that there was going to be a huge risk that the surgery would not be successful, or there was going to be a high chance that the cancer would relapse. But after the surgery, after some chemotherapy, um, he was constantly getting checked up, screened again regularly. So still to this day, the cancer has not relapsed and hasn't showed up. So we're extremely grateful for that. So colorectal cancer is also known as colon cancer. It is a type of cancer that begins in the final part of the digestive tract, also known as the large intestine. Although colon cancer can occur at any given age, it typically occurs in older adults. Usually it begins as small, benign, non-cancerous clumps of cells called polyps, and they form inside the colon. Let's see. As time continues on, some of these polyps can later become cancerous. The polyps are small and rarely produce any noticeable symptoms, which is why I strongly recommend getting regular screening tests and checkups in order to help prevent colon cancer. By screening tests regularly, this can allow the doctors to identify and remove the polyps before they are able to turn into colon cancer cells. Did you know that colon cancer is the second leading cause of cancer deaths in the US, or that 25 to 30% of colon cancer patients have a family history? 1 in 23 men will be diagnosed with colon cancer, and 1 in 25 women will be diagnosed with colon cancer. Did you know that colon cancer is preventable with early screening, or that 60% of colon cancer deaths could be prevented with screening? Here is a diagram of the stages of colon cancer. And for signs and symptoms, some of the signs and symptoms of colon cancer include persistent changes in bowel habits and movements. This includes diarrhea, constipation, and even a change in the consistency of the stool. Other signs include rectal bleeding, blood in the stool, persistent abdominal discomfort, cramps, gas, and even pain. Other symptoms also include feeling that, or a sensation that the bowels are not completely emptied. Some may also experience unexplained weight loss, weakness, and even fatigue. During the early stages of colon cancer, many people will experience no symptoms of this disease. Some symptoms may appear earlier than others, but that is dependent upon the cancer size, as well as the location of the cancer in the large intestines. It is imperative that you make an appointment as soon as possible when noticing or experiencing any of these symptoms. Although colon cancer screening is normally recommended at the age of 50, in recent years, doctors have recommended regular screening for people with, with average risk at the age of 45. And even earlier if they have family history of colon cancer. Okay, causes. As of now, doctors are still uncertain what causes colon cancer, but it is understood that it begins with healthy cells in the colon that eventually develop mutations in their DNA, and those mutated cells eventually replicate and spread. As these cells continue to multiply, it eventually accumulates into a mass of cells and form a tumor. Since cancer cells are able to divide and multiply faster than normal cells, these mutated cancer cells eventually invade and destroy nearby normal tissue. This allows cancer cells to travel and spread to other parts of the body, also known as a process called metastasis. Risk factors. There are a wide variety of risk factors that can increase the risk of colon cancer. Although colon cancer can be diagnosed at any age, the vast majority of people who are 50 years of age or older are the most common. However, doctors have begun noticing increased rates of people younger than 50 being diagnosed with colon cancer. Other risk factors include being of African American descent, having a personal history of colorectal cancer or polyps, inflammatory intestinal conditions such as ulcerative colitis and Crohn's disease, and other chronic inflammatory diseases of the colon can increase risk of colon cancer. Some inherited syndromes can also increase the risk of colon cancer, although only a small percentage of colon cancers are linked to specific genes. Having a family history of colon cancer will increase the likelihood of being diagnosed with colon cancer, especially if there is one or more family member or blood relative who has had it. Having a low fiber, high fat diet, typical of a Western diet, have also been found to have increased risk of disease, especially those who have high diets and diets high in red meat and processed meats. Other lifestyle risk factors can include living sedentary lifestyle. People who are normally inactive have increased risk of colon cancer, as well as smoking, obesity, alcohol abuse are other risk factors that increase the risk of developing colon cancer. Prevention. There are a variety of steps and precautionary lifestyle changes that can help reduce the risk of colon cancer, such as eating fruits, vegetables, and whole grains, drinking alcohol in moderation, avoid smoking, exercising regularly, and maintaining a healthy weight. Building good habits early can really help your body go a long way. Early regular screening for colon cancer through a colonoscopy is the best way to prevent colon cancer. Treatment. Screening for colon cancer is the first step. Normally, a colonoscopy is used for screening. Polyps can be removed during the procedure before they turn cancerous. There are 4 stages of colon cancer. A person with stage 1 colon cancer has an 80 to 95% survival rate. Stage 2 tumors have survival rates between 55 and 80%. Stage 3 has a 40% chance, and stage 4 colon cancer has a 10% chance. Chemotherapy may be recommended after surgery of colon cancer, stages 2, 3, and 4, to increase survival rate and prevention of recurrence. Surgery for early stage colon cancer include colonoscopy, endoscopic mucosal resection, and laparoscopic surgery. For more advanced colon cancer, the use of chemotherapy, radiation therapy, targeted drug therapy, and immunotherapy are used to treat the cancer. Seeing how common and deadly colon cancer is throughout the world, and especially in America, I believe by bringing awareness and passing on this information can help save lives, because regular colon cancer screening to catch early onset of colon cancer can dramatically increase survival rate. So please pass on this information to your friends, family, and loved ones. Thank you.